kind of you to be there, and we have to thank a lot. I don't know this guy, it's a little bit new in the Amwc, Sir George Sulamanidze, with his wonderful wife, Albina, and his brother, not your son, no, brother, his brother. He looks like a baby, so no. And George proposed us to have a debate, which is interesting because anybody is speaking about thread, of course, but we speak about injection, about dermatologic treatment, about surgery, and we want to discuss about the combination of the tolerance and the problem that we can have when you have a thread to make surgery behind, or to when you do injection, as if thread has special problem that they cause. Okay? So I don't know who is speaking first. That's normal? Yes. You are the big boss, the CEO. Yes. And really thank you for the invitation. I'm very, very, very touched.
Thank you. Thank you, Terry. Hello, everyone. Dear colleagues, this was a commercial symposium of Aptos. But we decided to speak about very interesting topic, which is in reality is not commercial, but during past period we have a lot of voice around the threats that threats somehow affect on facelifting operation later. So we wanted to discuss about it. We wanted to show you our opinion from Aptos sides as well, but from another side we need somebody who are not connected to Aptos. That's why we asked our good friends, great professionals in plastic surgery and in parallel in thread lifting procedures as well, Professor and Dr. Terry Bessin, Dr. Professor Naci Celik, and we have Dr. Sheila Barbarina. She will be a little bit later with us. They are not connected with Aptos. One more time, what I would like to say, we are not paying them for that. So they will tell us their own opinion about this question, but as we know, nothing moves without small grace on it. That's why I decided to bring small gifts for you, Georgian wine. So I think you will be more peaceful to the threats today. Georgian wine. So let's begin. First of all, a few words about the history of the thread lifting procedures, and looking on the past, we can see that even in many years ago, doctors were thinking about using different surgical suture materials for tissue elevation and tissue reposition. We are creators and founders of thread lifting market. We started with the first barbed thread, and first publication about barbed suture dated since 1998. First international presentation in the conference was 2001 in Bombay, in India, and first publication also in 2001, international publication, describing using threads, clinically using threads for the patients. The first generation of the threads, the first threads was produced for aesthetic tissue reposition and elevation, was made from polypropylene, non-absorbable threads, which is not so much common today, but still we are using them in the practice and achieving very nice result in some special indication, for example, for patients with face palsy. But of course, they have some problems. Let's say this is a foreign body material which stays all the time in the tissues patient face, and it can cause some kind of complications later on with the years. That's why Aptos started to think about absorbable threads, and we was thinking to choose the best solution for the absorbable threads composition, and we choose PLLA, polylactic polycaprolactone threads. It was our second generation product. Since that time started the era of absorbable materials. A lot of different companies started to produce similar threads with the different materials like PDO, polyglycolic acid, polylactic acid, polycaprolactone, and so on. And at this time period, we understood that except mechanical lifting effect, we also getting some kind additional result for our patient as a biostimulation. Different research, as well as clinical research and publications, was showing that different materials, whatever it is, polylactic, polycaprolactone, or PDO, PDS, giving us such kind additional result of stimulation of the tissues. In that case, we decided that we need something which will really affect on the biostimulation, and we add in our thread coating with HA. It was our third generation product, which gave us also very interesting results. With the different histological publications, you can find that except increasing collagen stimulation and except increasing elastin stimulation because of coating with HA, not cross-linked HA, we also was reducing inflammatory reaction around the thread, which also cause reduction of connective tissue formation, which is very important for today's topic, because connective tissue is the main reason which could affect on the tissues and could make facelifting operation, some difficulties for facelifting operation later on. And hyaluronic acid was a great solution for us. That's why we was thinking about the next step, how we can increase and prolong the working of hyaluronic acid, because we know that HA absorbs quite fast. It works like a good booster effect, but for short time period. That's why we came with the new type and new generation product, hyaluronic acid encapsulated in PLA-CL material with a small different size capsules which deliver hyaluronic acid within 6 months after implantation. All this gives us possibility to prolong the result of the biostimulation and to prolong the result of lowering the inflammation around the thread, which also cause reducing connective tissue formation around the thread. And all this, of course, shown on the different histological research which are published by Aptos and clinical research as well. It gives us really decreasing possibility of formation of fibrosis, so we are not storing scar tissue using that type material in the tissues of our patients. In case of Aptos, we have today 3 manufacturers. In each place, we have quite strong R&D department, and we are strongly working in scientific part, because behind all these commercial things should be science. And just as example, during past year, we created 4 new products. We completed 2 clinical trials, and also 2 more are ongoing and 4 planned for this year. We published 18 publications during past year about different ways of using threads, and several of them are on the ongoing process today. And the budget of Aptos in science is almost 30% from our turnover. Just to compare the quantity of the publications during past 10 years, we can see this very nice slide which shows the quantity of work we are doing each year for the scientific publication, which everything affects on reducing compliance from the patients and from the doctors. We have much less complications today, and doctors are able to use product much safe. So, in conclusion, what I would like to say, again, because this was the commercial symposium, Aptos developed and created the market, which is thread lifting market today in the aesthetic world. And we always working first on safety for our patient, looking on the quality of the products. And I'm sure if all the companies who are working with the different devices will do the same, and I'm sure most of them, they are doing the same, we will avoid any type complications in future. Dear colleagues, you can scan this QR code to get some additional bar points from Aptos because of today's symposium. And I would like to pass the word to Terry Bessin. Thank you very much. Dr. Albina will be the next speaker.
So, dear colleagues, so my part on this symposium is non-commercial, but the role is crucial. So why I'm talking about the role? Because all the time we are struggling with the stereotypes, especially with the plastic surgeons. For me, like for the dermatologists, all the time I can see in the social media or during, by the way, not now, it was like 10 years ago when the plastic surgeons were the chairman, like in MWC or IMCAS. And when I was presenting my presentation with the threads, and all the time we were struggling about what we can achieve with the threads. It's quite a big fibrosis. You even don't understand how deeply it will be in the soft tissues and how it's going to be impossible after the threads to do the thread lifting. So today I would like to talk about generally what is happening today. Yes, we have in aesthetic medicine dermatologists. The main, our specialization is we try to rejuvenate our patients in an absolutely natural way with injectables like fillers, with a botulinum toxin, with energy-based devices methods. And plastic surgeons, which are more, let's say, predictable for the long-lasting results and for more aggressive intervention like surgery. Before I will start to explain what is the benefits or what is myths or what is truth, let's understand what is scaring the plastic surgeon, the fibrosis. All the time, the fibrosis, and fibrosis. But we need to understand that fibrosis is a normal process of connective tissue proliferation that occurs in response to any kind of injury or inflammation. It can be skin boosters, it can be fillers, it can be even any type of the empty injuries into the skin. So it's the body's mechanism aimed at repairing and strengthening damaged areas by isolation them from the healthy tissues. But at the core of the fibrosis is the active production of the collagen and other extracellular matrix components, which is absolutely needed for us, for the biostimulation, biorejuvenation. And yes, we can divide this fibrosis into the bad case and good fibrosis. So in the good let's say good fibrosis for the biostimulation, we first of all is control collagen first and third type stimulation with the balanced extracellular matrix, which is have a crucial role in remodeling, restructuring of the skin. But from another side, we can still see the bad results with the expensive uncontrolled fibrosis, uncontrolled collagen deposition, which leads for appearance of the hypertrophic scars, keloids, and tissue hardening. So the first question regarding the threads. I'm not going to talk about only the Aptos. No, you can see like in this table, here is absorbable threads and non-absorbable threads. There are a lot of studies regarding of the biostimulation, collagen formation, capsular formation around all type of the barbs. Like, for example, we can see and observe induced control connective tissue grow around the thread to support the lifting effects. And also it's proven, and also we have seen a lot of evidence on this, especially for the absorbable threads like PLA-CLA, yes, PLA-CLHA, yes, PLLA, Yes, even for the PDO, we can still see and observe collagen stimulation. And regarding non-observable threats, first of all, yes, it provides long-term support, but may lead to prolonged foreign body reaction and excessive fibrosis. The main key is not about your tool, how you are doing, providing the procedure. And first of all, the plastic surgeon should deal that there is no virgin skin concept still exists. So due to the social media, yesterday there was a lot of sessions. We were talking about the new generation of the patients, the social media, that they're explaining, they can prescribe even themselves the procedures. So it's very rare to find a lady without no even skin booster done before. So you can see mesotherapy, skin booster, yes, it's also injury. It also leads to the fibrotic tissue connection, yes. But today, the Botox and the filler is like a normal, like for example, when the patient is coming to me, I never done before nothing. But I can see the Botox on your forehead. Yes, but this is a Botox. It's like nothing, but this is also injections. So plastic surgeon, especially for those who reject all the injectables, should understand message, there is no virgin skin in nowadays. With the growing popularity of non-surgical intervention, with the start from the earliest ages, that's what we see today during our daily practice. So let's talk about myths and reality. I told that I'm not going to talk only about the threats. The same thing with the fillers. So the plastic surgeon says that you should not be injected with a big amount of the fillers because it will inevitably cause to the tissue fibrosis. But reality, fibrosis can occur with the use of low quality of the product. So what does it mean? Please look at the rheology of the filler. Look at the technique and look at the amount of injections in the one session. So all this makes sense. So, the main complications is unfollowing on-label rules. When you are trying to shift, for example, good quality with the European quality fillers to the most cheapest and to inject in the big amounts. This is exactly what leads for the adverse events. What about energy-based devices as well? Here is a myth that like such procedures like microneedling, RF lifting, ultrasounds machine, and lasers and other energy-based devices can lead to the skin fibrosis. From one side, we need this good fibrosis, but from another side as well, here as well, we can achieve a big complication if we are following the rules, following the protocols, not properly selected patients, even the patients are not following the recommendations after the procedure. This is the main problem. But what about the surgical intervention like lipofilling and liposuction? Of course, we can see the mechanical trauma from the much more aggressive intervention with much more bigger cannulas. And here as well, we can even feel under the skin the uncontrolled fibrotic scars under the skin. Even the facelift, it's known that we can see, observe even visually the scars, and even with injectables like skin boosters to the patients after the facelift, we can see the protection, so we can see the resistance with our needle. And for us, for dermatologists, it's a little bit difficult to provide any type of recovery treatment after such treatments. As well, this is a very nice article. You can take picture of this article. This is a plastic surgeon surgeon. He wrote about how minimally invasive treatments can render a subsequent facelift more difficult. But the most interesting is that the objective of this study was to evaluate the challenges posed during the facelift in the patients previously treated with the fillers, with the toxins, with skin boosters, with the threads, and other injectables. So it was a retrospective review of 552 participants, which was performed the plastic surgery. So in the results, what he was talking about, that the common issues included cheek fat atrophy. It was about 7%, was significant scar tissues and complications from the large volume, from the unfollowing the proper technique and proper products. Also, it's a very interesting view from the side of the plastic surgery, and this is, let's say, the grade which I was thinking about how to create, how to understand the fibrosis severity level. And if we will compare all the procedures, it's a big question of the discussion, who is given much more fibrotic scars under the skin. So my main idea and conclusion and my message to the plastic surgeon, and I think that mostly of them should deal with that there is no more virgin skin. Only with the teamwork for optimal outcomes, patient safety and satisfaction. This is the main key why we should work together, dermatologists and plastic surgeons. We can prepare the patients before the surgery, and we can help you to recover this lady, to have a shortest recovery time. As well, adaptation of minimal invasive procedure. We should understand that yes, injectables and threads, biostimulators, energy-based devices, they should be and they will be, because there is no more, let's say, patients who wanted to have a surgery. Some of our ladies, even in a deep age, they don't want to have any type of intervention. They would like and prefer a very natural look. And of course, adaptation of the surgical intervention as well is very, very important. Thank you so much for your time. So the next speaker is the plastic surgeon, Dr. Konstantin Sulamanidze.
Thank you, Albina. Hello, dear colleagues. Professor Bezins, thank you for this compliment that I look good. Bezan, sorry. Sorry, Bezan. Anyway, thank you for compliment. It was a big compliment because I already have some Bezan. Professor Bezan, it's a pleasure. I have not bad experience in plastic surgery, so I can say that I'm doing for 20% of my practice threads, Aptos threads, and the rest 80% I do plastic surgeries. So I can speak more from the side of plastic surgery. And this noise that today we can hear, mostly in social media, about the problems of surgical interventions after minimal invasive techniques. Did you ever see some kind of words from really expert plastic surgeon? Most of those doctors who speak that minimal invasive techniques are bad and it affects for future plastic surgeries are the beginners or the doctors who don't have so much patient, but the real experts, they are ready for any kind of patients. They understand that today we have a lot of different techniques, minimal invasive techniques, and patients underwent these procedures before the surgery. How Albina said, no virgin skin. Today we don't have any patient. I think that the very small percent of patients come to us with native skin. So if we will see the statistic, in 2013, for example, there was not too much methods in aesthetic medicine. That's why the average age of facelift surgery was 51 to 60. But today, there are a lot of solutions for rejuvenation, non-invasive. That's why average age of facelift today is 65 plus. We are the family of plastic surgeons, so we work for plastic surgery for many years, and also we have a big experience of non-invasive and thread lifting procedures, so we really know how it works. For example, this is the case of one of those doctors, of plastic surgeons, who started the practice of thread lifting in 2000 year, and during 6 months before that, he did only 28 facelifts, but 8 years after, he did the same amount of facelift, but plus 228 rejuvenation procedures with minimal invasive techniques. That means that if surgeon will do minimal invasive procedures, such kind of thread lift, they will not lose his patients in plastic surgery. He will have more patients with new things, with new indications. So we all know about possible zones of correction. They are more or less the same when we speak about plastic surgery. We can work with upper face. For example, in surgical way, it could be endoscopical lift, which really gives a result for 4 years, 5 years, but not more. Or we can do the same with threads, with less invasion, with less rehabilitation, but of course with less long-lasting effect. But it's a minimal invasive technique. And the same, we can work many things for the face, for cheekbone and jawline and submental area. But we should understand the correct indications. These patients, you can see on the photos, are the correct indications for the threads. I think it's very early for them to do big surgical interventions. But such patients with heavy faces, with laxity of the skin, of course, they need surgery. And when we treat such kind of patients with minimal invasive techniques, with even threads, which are great, but threads will not work for them. So we need to understand that threads, it's a great instrument for even plastic surgeons to work with the patient before the facelift, during a facelift, or working in different zones. For example, we can do endoscopical lift for the patient's upper zone, but lower face we can treat with threads. Or after the facelift. Many surgeons, how I told, create this noise about the problems of minimal invasive techniques, but they are not saying about the problems of facelift. We know that each 5th facelift, surgical facelift in the world is secondary. Just imagine. So sometimes we don't need to make secondary facelift. Sometimes we can improve some things after the facelift with a great instrument as a thread. And also we are working in different zones, in different layers with threads and surgery. Threads should be placed in subcutaneous tissues, but surgical facelift, we know that we can do different type of facelift, SMAS plication or deep plane, and we are not affecting to these layers with the threads. This is a nice video of the surgery for the patient who underwent previously many procedures of Aptos thread lifting with absorbable and non-absorbable threads. The last procedure was a few years before the facelift, so we can't see absorbable threads, but we can see just a regular undermining, mobilization of the skin, no any problems for the undermining. We can find some old threads, non-absorbable threads, proline threads, and we can remove it. We can remove these threads during the surgery, or sometimes we can see that they have so nice fixation that we can pull them again and make plication with the existed threads. And this is not only our opinion. You can see some other opinions of some other plastic surgeons who found a lot of threads on the patient faces during a facelift. And it's not a problem. It gives additional 5 to 10 minutes to deal with that during a surgery, but it will never give any problem. And this situation is not only about the face, cheekbone area or jawline. The threads can be a great thing, great method to improve rhinoplasty complications, to improve rhinoplasty cases. This is the patient. This is a patient after 4 rhinoplasties with a nasal valve problem, prolapse, and we treat this problem with threads. Or, for example, this is a George patient. A patient after rhinoplasty, you can see columella show, retraction of the nostril, and in case of surgical intervention, we need a rib graft and we need a big surgery to improve it. But with a thread, we can do it easy in 5 minutes. So it can improve our results of plastic surgery. And also, we can improve many results in cases of round eyes, for example, or in cases of asymmetrical patients after face palsy problems, or how I told, we can use many techniques in combination to improve our surgical result. For example, here I'm doing for the patient temporal lifting, surgical lifting, then injecting a fat around the eyes, and then working for the lower zone with the threads. All this we are doing to improve our results. For example, this is the patient after facelift, and you can see the scar is too far from ear, and also this pixie ear, and we can fix these problems just with threads. We don't need additional new surgery. We can fix such difficult problem after the surgery with non-invasive technique. So this is one more patient. This is my patient, 4 years after liposuction of submental area and permanent threads, and you can see 4 years after it looks very good. Again, one more patient, it's my patient. In one session, I did for her upper and lower blepharoplasty, preservation rhinoplasty surgical way, and full face Aptos thread lifting. So it's a great example of the combination of the threads and the surgery. One more, my patient, upper and lower blepharoplasty, liposuction of the submental area and threads, everything under sedation, by the way. Or the patient when I combined surgical facelift with incision and Aptos threads just for plication, because plication of the SMAS with a barbed suture is much more effective than with a smooth suture. So for the conclusions, again, no virgin skin concept in plastic surgery. Today we are ready for any kind of patient after minimal invasive techniques or secondary facelifts or secondary rhinoplasties. And if you are experienced plastic surgeon, you should know how to deal with it. So we should think about collaboration between dermatologists and plastic surgeons for improving our results. Thank you very much for your attention.
Very scientific. We appreciate. How do you want to make the debate? Oh, please.
You can drink first.
That'll make it very interesting.
So, did you present Sheila?
No, not in this session, but earlier today. So, those are excellent results with your corrections. It just shows us how much you can do with threads. What would you, if you had a patient that wants to have a facelift in 6 months and they come in for threads, would you recommend them having thread lifts? How long after having a thread lifting procedure do you recommend having a facelift so they can kind of make a plan? Because with my patients, I make a plan 3 months, 6 months, in a year, 2 years. I have a mic right here. Oh.
Yeah, please. Okay, can I ask you one question? When you say that after the facelift we have a final result, after 6 months, 8 months? So after that you can do threads. Even before, even 4 or 5 months after, you can do it without any complication, but it's better to wait for a final result than to check where is the problem after the facelift, and then you can correct it with threads.
But But if
No,
a patient says,
actually-
I want a Band-Aid, sorry, I'm 6 months until my vacation time is 6 months from now. What can we do right now? Can you do thread lift right now? Because I have, a date, a wedding, whatever. Would you do a thread lifting procedure at that point?
It depends how is the situation after the facelift.
No, before a facelift.
Before the facelift. If she's planning to do facelift
In 6 months.
in 6 months, I think she should wait for this. It's better if she really knows that she will do facelift after 6 months. It's better to wait.
Okay, in my opinion, if the patient has a facelift, I did the facelift, I can see the result immediately. Next week, I can see the result of the patient 6 months after. She doesn't see that. I can see that. And if she needs a thread, I would put the thread immediately. I don't want, because if I know that there is a problem with my facelift, I want to correct it immediately. I don't want to wait for 6 months. I don't want to wait the patient to see the problem. I want to solve the problem immediately. In 1 week, I put threads, so there's no problem. And thread lift after facelift. I have never seen a patient in my practice who comes like 6 months after a thread lifting for a facelift. No, they're happy. They don't come for a facelift. So you can wait as long as you want, and you can do the facelift after. And there will be no problems with the absorbable threads before and facelift after. Even with the non-absorbable threads, I do non-absorbable threads, and I do facelifts, no problem. And I'm very happy that some doctors think that it will be very difficult to do a facelift after non-absorbable threads or absorbable threads. Anyway, they send it to me in Istanbul. I'm very happy with that.
So I think maybe we are not right when you make an opposition between surgery and thread. Thread is a very nice device in addition of all that we can do in surgery. And complementary or improvement. So we are not, the thread is not the enemy of the facelift. And in my opinion, you can do a facelift whenever you want after threads, whenever you want. Because in one time, maybe you will have a small fibrosis for the resorption, the other time. But if it's well tolerated, if you have no infection, the thread is here, he's happy, he's in his bed. You can do what you want with the thread. You are not obliged to remove them. You can tighten them a little bit more if you have some length enough, or you have no reason to. But in addition to surgery, it's fantastic because you can minimize the surgery to, for instance, do a facelift of the neck and adjust the thread for the malar elevation, or to have a completion of insufficiency of the result for a small bajou which is coming. You can put a thread, and I agree with him. Don't wait. Don't wait, because you know perfectly that you will have a problem. So during the first few days, the patient is okay for everything. She's not okay after, because it's again, and you enter again, you have small edema, and so on and so on.
So I feel like the argument or the discussion comes from the non-provider, the non-surgeons versus the surgeons, because I think like all of us surgeons that have been there, we've seen threads, we've seen other modalities. Do they affect our surgery? Sometimes it complicates it. We all kind of agree that it does. Threads don't complicate it. So what I'm thinking about is our message to people that don't operate. A lot of them are saying the reason why they won't do threads is because they don't want to refer to me, a patient, in a year, in 2 years, and have it more complicated. What other modalities other than threads do you actually tell people that don't operate that they shouldn't do prior to you operating on them? I mean, you guys are, these guys are, nothing scares them, right? So they're going to go in, and they can deal with the complications. But there are some things that make our surgery more difficult. What would you tell somebody that doesn't do surgery?
Are you sure that we are not scared of anything?
I don't know. I'm like,
Okay. Okay.
I've never seen either.
I am scared of that virgin patients. She is at 65 years old. She has never done anything. No Botox, no fillers, no press. And she comes for surgery. An irreversible thing. That's a complicated surgery anyway. I'm scared of that lady. I don't know how she will respond to what I change on her face, because she never experienced such a thing in her life. So I tell them, okay, let's start easy. Let's do some Botox. I want to see your reaction. Let's do some press. Try it. I want to see your reaction to what I do. And if it's good, and if you respond good, then we can move on. But if you don't like it, okay, we will wait, and it will be okay. So I'm scared of that virgin ladies. I like them, but I'm scared of them for the whole of my life.
And the most difficult case in the middle-aged patient, which is a very good indication for thread. But a lot of people ask for a facelift, and more actually because of the Ozempic.
Yeah.
They are losing a lot of weight and they are aging a lot. It's good for the fat, for the body, and for that, but it's not good for the perception of aging. And I think when a patient has done nothing, you have the choice. It's your honesty. You say, I think it's a very good candidate for a facelift. She must have a facelift or not. If not, it's very simple. You say, we do threads, we will see, and you have time to look like an old woman facelifted. You have all your life for that. We can do a facelift all your life, in 5 years, in 6 years, in 10 years. But please, don't go in front of the damages too early. Even the scar is a damage. You never know how it helps.
Never guaranteed.
So it's a deal, fantastic deal, because and after we will see. It's your experience who knows exactly what to tell to your patient.
So if a patient's previously had HIFU, do you think that affects your, or Sculptra, or all these other, the PLL, all of us want to know, that's what they want to know from us. And I have my opinion, but I want to hear all of your opinion. So I agree with you. The virgin patient is, you're dating when you're giving them fillers and Botox. But what I want to know is, if they didn't tell you the history, would you know HIFU or radiofrequency microneedling or what?
Yeah, of course, I can definitely understand that what had happened before, and for that specific patient during the surgery, they don't tell me about the HIFU, and I asked them later, why didn't you tell me about you had a HIFU? What is HIFU? That ultrasound, it burns a lot. Yeah, I did that 10 years ago, and it's still there, and it's very complicated, especially in the neck area. You cannot dissect the skin undermine the skin.
Biostimulators, all the biostimulators that are
No, but there's an important word from Albina. Good fibrosis, bad fibrosis. I have my reserved, I don't want to give a name, but yeah, I prefer calcium hydroxyapatite.
Yeah, I want to hear.
But not PLLA.
Oh, so you think calcium hydroxyapatite
is better in terms of good fibrosis, but it's just my opinion.
Yeah.
Okay, don't trust on that. You do that. But PLLA is a little bit. That's a little, PLA or
PLA.
PLA. Okay, it's a little bit. It's a little bit difficult, and it gets a fibrosis, which I don't want. A good skin rejuvenation, stimulation comes with a soft skin, not a hard skin. I don't like that. And when it's hard, it's very difficult to do any dissection of the skin, undermining of the skin. But with calcium hydroxyapatite. I use that. I don't see that problem. For example, HIFU is a problem.
And radiofrequency microneedling?
No problem.
Absolutely agree with you. But regarding the opinion, our opinion should be based on the evidence, yes, and articles. And for sure, we can see a very nice articles with the collagen stimulation due to the hydroxyapatite calcium and PLLA. Regarding Sculptra and others, my opinion is the main problem is in reconstitution of label techniques, methods, because when, for example, one of the biggest pharmaceutical company launched hydroxyapatite calcium with hyaluronic filler, everybody started to inject the temples. It's very wrong. It's absolutely wrong. And after 1 year, 1.5 years, when they were injecting 3-5 syringes in one session, some of the doctors, I met them here, they said, oh, you know, it feels like a granulomas. I have adverse events, not in 1 case, 2 cases, 3 cases. Complications going to be everywhere, like the scars formation after the surgery. Yes, this is a normal, but we need to understand the technique, the product. And regarding virgin patients, agree with you totally. When the lady is coming 65 or 70 years old, I never done before, nothing. As well, I'm afraid to take this patient because I don't know what kind of response gonna be after the fillers. Even she's complaining about nasolabial fold. Okay, I will inject this nasolabial fold, but what's gonna be the migration to the fat compartment, nasolabial fat compartment, and she will come, she will start to complain, why you did it for me, why you didn't told me that I needed to biostimulate my skin. So that's the same with the surgery. Before we will send it to the surgeon. I need to prepare for you a good materials. And after that, it's easier going to be for you and the recovery time will be much more less. And the threads, I'm not sure, I'm not a surgeon, yes, but I'm experienced dermatologist, is how I say.
Yeah.
And my PhD was on the pharmacology. And what I saw that these biostimulators, you know, there is opposite view, positive and negative, depends on the specialist. If you are advanced plastic surgeon, for you to remove the thread, it will not take a lot of time. It's just a question of only 1 minute and force, because even the proline threads and the silicone threads, if you know how to do silicone threads, you know how to remove it. With the proline threads, even me like a dermatologist, I can easily remove it even with a needle, 18-gauge needle. So I think it's just a question of the hate in the social media.
Right.
Yeah, just
There's so much
to make some noise about the topic.
Disinformation out there, and that's why I think that's why we did this session, is because, you know, we're hearing so much hate against thread lifting and thread lifts because people are saying, oh, well, I don't want to cause a problem for my patient for the future of their facelift, right? And in fact, I've heard patients come in and say, you know, I don't want to get filler because what if I want to get a facelift in 5 years? Clearly, that's not a problem. And in fact, in my patients, some of those really malnutrition, very skinny, old ladies that we see all the time that need a facelift, sometimes I'll prepare them for a facelift leading up to a facelift with some of the biostimulator products, because once I do a facelift on them after we stimulate some collagen in them, it's going to be an even better facelift.
To summarize a little bit, not because it's finished, but the question was, must we be afraid of the threads to decide the facelift? It's nothing to see. It's two different things, I think. It's not a problem. You're not obliged to know that people had thread before. It's not an obligation. It's an obligation for all the products that we know very toxic, okay, but they are actually very rare, not so much, you know, by your.
Yeah. So,
But thread, surgery, nothing to see. For me, it's for the doctor, for dermatologist, oh, you have thread, you cannot have surgery. No, it's not a lot of inflammation, it's not a lot of fibrosis. I don't speak about infection or problem, of course, but normally it's not a problem.
there's other just some false things out there about threads, like microneedling radiofrequency, does it break the thread? Does it weaken the thread? I want to know from you guys.
I don't think so. I don't think so. It will be very difficult. I mean, the level of the microneedling radio frequency, it's at most maybe 2 millimeters, not deeper than that. But the threads are, deeper. Threads
Do you
are
think
deeper. No,
No.
I will answer instead of you.
Yeah,
No.
and for him, the other thing that is dissemination out there, he's so bad.
But
is
again,
that-
HIFU is another thing.
What's that?
HIFU is another thing.
HIFU is
Again.
another thing. Some people also think that using threads will dissolve fat around the thread. So if you do get it into the fat pad or one of the deeper fat pads, do you think it affects the fat pad?
Yeah, I understand, but I don't think so. I mean, the fat,
No,
no,
I don't
No.
think so either.
no.
I mean,
I mean,
It's
if
important to what level
foreign
you're- yeah.
body reaction or something like that may cause that kind of problems, but we don't see that kind of problems actually in the real life.
that's right.
In theory, maybe. I don't know. She is the PhD.
Yeah.
Tell us.
Have you seen apoptosis or any sort of fat dissolving by threads being inserted into the face?
So we have a big database on this, but we honestly had no such cases. Yeah, nothing is observed because I'm looking at our R&D head and George because in my opinion and as I remember, there is no such kind of complications with the threads. Yeah.
Right. But have you heard that, again, if they're being perpetuated by the public that doesn't operate, that doesn't treat patients, that doesn't, right? It's just things that they've heard, right? Do you guys have any questions for our expert panelists? Because we want to also,
Yeah,
if
and
you've
I
heard,
want to add something. When we are doing facelift, are we doing facelift like a magic? We are using sutures.
yeah,
Those sutures are PDS, Prolene sutures, whatever suture you use, monocryl, whatever. These are the sutures. These are the foreign bodies. These are these.
that's what we use
have
every
the
day,
same
every
effect.
day since Kingdom Come when we started doing facelift.
And
Correct.
So
And if we were going to see a complication, we would have seen one by now. Correct.
with the same.
Does anyone else have any questions for our panel? It's a great opportunity to anything that is preventing you from using more threads? Anything? Yeah, please. You raised your hand? Oh.
Is there any specific stuff? There is a question?
Nobody has a question?
Okay, we are 6 people here, right? How many of us have threads in their faces? Of us have threads in their faces.
What kind of threads do you have in your face? I want to know. What kind do you have? I want.
Don't you have any thread on your face?
I have one.
Yeah, okay.
Just one side.
So only
Once.
only the baby. No.
In Nice?
Yeah, good. So I'm a plastic surgeon, and I'm not afraid of having my non-absorbable threads on my face, and I'm not going to go for it
That's in.
for a facelift surgery for a long time because I have threads. I know George now.
That's a very nice question because, like all the surgeons, we want to taste something, to test what we are doing, and of course, you are Fred.
Yeah, of course.
Yeah, everybody has.
Yeah, I would have gotten one yesterday.
And I wanted to know, it's impossible that I don't feel it. It's impossible that the airport is, no. It's impossible that it's not hurting. It's simple. And you forget it. I think it's a wonderful device. And we are not speaking about absorbable or non-absorbable. That's not the problem. You do exactly what you want and what you know. But there is no correlation between facelift and threads.
Yeah. One thing that I thought was really interesting that you and I were on the same panel at AMCAS. I am from the United States, so I always feel like when I come to these conferences, I feel like I'm the poor kid on the block because you guys do such advanced things compared to the United States. But I was on a panel with all plastic surgeons that operate, and 90, there was only one person on the panel that didn't always use threads and surgery at the same time. Do you do surgery and threads every time?
And thread,
Yeah.
just together?
Yeah.
Of course, it's so cool. You
It makes sense.
you have the pin, the forceps, it's a device and the coagulator, and the thread. And you use the thread when you want, where you want, at the moment or you want, the moment or you need.
Well, I think of how we want them to wear compression garments after surgery. Why do we want them to wear compression garments? Why do we use those nets? Why do we try to keep everything tight after a facelift? It's because we want them to have the best outcome with the best longevity, right? What if we can put something internally that can actually keep them tighter for longer while they're healing? I think it's a win-win for the surgeon as well as the patient. So I think that it totally makes sense, but I don't know why I never thought of it before. That's why I come to these meetings.
You're going to change.
And now I think the last month since I've been at AMCAS, I did every facelift. I've added dissolvable threads because we don't have the permanent threads in our country, but I think it helps with nasolabial folds, which I don't care how deep your deep plane facelift is. Deep nasolabial folds are the hardest thing we deal with. How can we have an extra reach to lift that nasolabial fold? How can we get that extra tightness on the neck? It's very difficult. And I think that threads in conjunction with surgery are very powerful.
For both of you, the two brothers, or Professor Biochimie, how do you explain that we are more inflammatory reaction with the resorbable stitches? I'm speaking of surgical stitches, or a nylon stitch. You have no inflammatory. See?
We have inflammatory in all time.
Yeah, in all time, but
This is a normal reaction.
like that with the nylon, and more important with the Vicryl. We use Vicryl 40, 10, 20. We have a big reaction sometimes.
Yes, quite a big reaction, depending.
And we did not this to heal. We need not do inflammatory process. You can use the inflammatory process to have a better healing and a better skin and so on. But a good inflammatory, I learn a lot.
I have a question.
What's your answer?
Is to use resorbable threads. It will decrease the inflammatory reaction due to the composition, like HA, which is not with the PDDE, is a native. Exactly the main goal of HA is to decrease inflammatory reaction, which is a normal during any type of injury. And for the long-lasting PLA, that's like the main.
So we don't have PCLs in the United States. The difference between the inflammatory reaction with the PDOs versus the PCL, what's the difference? How is one more inflammatory than the other?
The PDO, the PDO, the reaction is a little bit deeper and the duration is shorter. The PDO manufacturers that says that it won't last up to 6, 8, or 10 months.
Right.
It's a mistake. I think it's like a myth. Because if we're looking to the histology, it's not more than 4 months. The rest is exactly the fibrosis that's inside in the soft tissues and it's creating like a network inside.
Right.
So that's why it's not dropping after 6 or.
Right. Due to the neocollagenesis that's formed, right? So why would a permanent thread, which is like silicone, like the
That's sexual harassment.
not the HR is going to come take me out. I love him.
No, don't begin.
He's such a pain in
Don't
the
begin.
But what is silicone isn't inflammatory if it's in a rod. Is that correct? Or am I wrong? You know, the permanent, we just don't know? Because you would think, because in oculofacial plastics, we have a silicone sling, which I put in a ton of young kids with congenital eyelid ptosis. And I'll see them now and they look great and I've never had a problem. They've never eroded through like, fascia tensillata or other products we use that are super inflammatory.
You mean any inflammatory reaction or foreign body reaction against the silicone?
Yes.
No.
Yeah.
No. I don't see any foreign body reaction with silicone threads.
Threads.
But I saw sometimes infection is something else.
Correct.
But if I don't do that in a proper way, I can see sometimes reactions, which is not the silicone, but the polyester inside. I can see a foreign body reaction against polyester, but which means that I did something wrong. I left the polyester part inside the skin. Right? Polyester has, yeah, it's not with the silicone that I'm using right now,
Right.
but in previous threads, I have had this kind of problems, but I don't see that. With silicone, no. Or we have silicones, I don't have, but many have silicones in their breasts, and the grade of the silicone in the press is probably much better than that silicones. Implants, I mean.
All right. Thank you guys so much. I'm hearing that we have to wrap it up. Thank you guys for joining us. Excellent session.